Okay, hi everyone. Thanks for joining us. I'm here with Dr. Vinny as always. My name is Krista Gervon, and this is the Invincible Health Series with Dr. Vin. So coming off of last week, we discussed the new variant Delta of COVID-19. So we're going to continue a little bit on that conversation just because it is still spreading and we want to help anyone who's watching protect themselves and stay as healthy as possible. So today we're going to talk about COVID, how to prevent, what to do if you're exposed, and how you can manage it if you have been diagnosed. So we're going to jump right in. Dr. Vinny, what can we do? What are the best measures we can take to prevent an exposure to COVID or prevent getting COVID?
So to prevent getting COVID, certainly we're seeing still spreading of COVID right now. So I would say that, for me, and I think for anyone, if you want to avoid getting COVID, whether you're vaccinated or not, because we're seeing breakthrough infections and people are vaccinated at this point, you can, if you choose to avoid, going into crowded, poorly ventilated areas. If there's poor ventilation, if there's virus there, it's going to be hanging around for people to breathe in. So, you can totally avoid that. People are, but everybody's kind of hungry to get out and to go places. So, that might not be, what people want to do. If you go into a place like that, if you can wear a mask, that will reduce your risk. Of course, it's not going to reduce it to zero, but it will reduce your risk. But if you go in someplace to eat and drink and it's crowded, most people are going to be without masks there. So I think you just have to do your best to socially distance, be cognizant of what's going on around you, and try to do your best to maintain your social distancing and that kind of thing.
Right. Nothing is 100%, but when we layer forms of protection, it can help our chances of avoiding.
Yeah, absolutely. And being, now in a much more holistic practice, things that I have people do to help avoid getting if they are exposed to COVID, are doing things like making sure their vitamin D levels are good, taking supplemental vitamin D if need be. Quercetin, most people haven't heard of that one. That is a botanical that is anti-inflammatory, immune modulating, stabilizes mast cells, so helps with that immune modulation and making sure your immune cells are working as well as they can. Let's see, vitamin C, old standby favorite.
Yep.
Taking that can be very helpful. And melatonin, most people think of melatonin as one of those things you take if you can't sleep at night. Right. What most people do not realize is that melatonin has its own antioxidant, anti-inflammatory, immune modulating properties.
Oh, wow.
So taking melatonin at night can be very helpful. It could make you sedated, so take it at nighttime, even though you're not using it to sleep. Right.
So, and then all of what you just mentioned are helpful if you feel like you've been exposed to COVID or if you know that you've been exposed to COVID.
Yes. Well, I recommend, in this day and age, when you could get exposed, just having that stuff on board. There actually have been studies that people who come, that people who have higher vitamin D levels are much less likely to have to go to the hospital. If they get infected, they're much less likely to have to go to the hospital. They're much less likely to have to go on ventilators, and they're less likely to die. So that's good enough for me. It's not like we're asking people to take some immune suppressing drug or anything like that. We're asking them to take vitamin D. If you can get enough from your sunshine and get your level over 50, great. Yeah. But most people usually have to supplement to get above 50, which is where the real benefits start to come in.
Got it. Okay. And so is there anything else besides what you mentioned that maybe you can do once you've been exposed and you're not sure whether or not you've tested positive yet.
Yeah, I mean, certainly if you have a strong exposure, you might up the levels of those vitamins somewhat. And, I'm part of the Frontline COVID Critical Care Alliance now.
Right.
So, we've followed their protocol. So you can look at their website, flccc.net. So there are certain things that can be added. Dosages, supplement dosages that are recommended are usually increased if you get to that exposure point, to again try to help stimulate the immune system to try to, either decrease the chances of getting COVID or at least making it less severe if you do actually get it.
Right. So leading up to that, if you know that you have a diagnosis of COVID at that point, would you recommend all of the following as well? And then in addition to anything else?
Yeah. So if you actually get COVID,
Yes.
then again, doses of supplements go up. It's recommended if you can take it because of the issues with potential blood clotting to take some aspirin. And while you're suffering from that acute phase of COVID, and for a few weeks afterward, probably. And then again, there are other measures on the FLCCC website that can be followed if people are interested in that.
Right. And so we do have some Facebook viewers right now, and someone actually is asking about a particular treatment. We're probably not going to get into the particulars because everyone is a very individual case-by-case basis, but please feel free to give us a call. We're happy to talk to you about any particular treatments you might have questions about. If you have any other questions, feel free to write them in though. But yeah, definitely try to prevent exposure. It's not something you want or want to deal with, but there's lots of different ways to manage it, as Dr. Vinny explained. So if there's anything else you want to share with anyone that's watching.
Yeah, no, I think that's it. Oh, I also recommend that people get a pulse oximeter
Yes.
and have it at the house, just in case. There we go. This way you can monitor your oxygen levels, or if you don't want to get one, at least know where you can get one quickly. Send somebody to the store to get one for you. That's, obviously critical because it's when the oxygen levels start to decrease that people are getting into trouble. So, yeah, so I recommend also having that on hand.
Yes, definitely. And since we do have our little ones to still think about who have no choice in the matter, but we want to protect them as well. So is there anything particular maybe for children too?
I would think, maybe just getting them on, a little bit of, some making sure that they're having maybe a multivitamin, a little bit of vitamin D, that kind of thing, some vitamin C, that's really pretty much safe at any age. So you can do that to try to help their immune systems function as effectively as possible. So.
Yeah, leading up into the school year, I'm sure it's on a lot of people's mind. I know it's on my mind.
I am sure.
So, all right. I don't think we have any other questions on Facebook, but I do appreciate everyone who came and joined us today. I believe, Dr. Vinny, you are on vacation next week.
I am on vacation next week, yes.
Too. So
I'm going to try to boost my vitamin D levels.
Absolutely, yes. Before the start of the school year, we're both going to take some time off, but we will be back in September. September is Healthy Aging Month, so we're going to do different topics throughout the month, all about aging and keeping our health as we age. So hopefully you'll join us then, and we'll keep you updated on those dates and times on Facebook and on our email and all that. Anything else?
I guess that's it.
All right. Well, thank you again, everyone, for watching. If you caught us at the end of the video, you can check out the video. It'll be posted on Facebook and also on YouTube. And we will see you soon. Thank you, Dr. Vinny.
Okay. Thank you, Krista.